Hello, my name is Liz Miller and I'm the Chief Pharmacist at the East Midlands Ambulance Service.
And I'm Louise Monnick. I'm Chief Pharmacist at South Central Ambulance Service, and I'm also the Chair of the Medicines Governance Group that links to JR Calc. The JR Calc 1.25 update includes some updates to the medicines monographs for tranexamic acid and ondansetron. And we've also included the missed medicines poster, which will sit inside the medicines overview guideline in the medical emergency section of the JR Calc Plus and ICPG.
The tranexamic acid monograph has been updated and now includes a new indication for patients with confirmed miscarriage and excessive bleeding, as well as an amendment to the postpartum hemorrhage indication. This now indicates that in primary and secondary PPH, tranexamic acid should be given after uterotonics unless they are contraindicated. Please be sure to refer to the Management of PPH guideline for definitions of primary and secondary PPH. This indication also refers to women who are breastfeeding. Finally, dosages for patients aged 10 and 11 years have been included for confirmed miscarriage, excessive bleeding, and for PPH. It should be noted that this medicine requires a patient group direction and that staff should always refer to their local PGD for guidance.
Following some concerns raised about the administration of ondansetron during pregnancy and breastfeeding, and due to the increased risk of cleft palate, we have introduced two new sections into the ondansetron monograph. Now, this is in line with the new monographs that we're producing. So we now have a pregnancy section, and in this section, ondansetron is contraindicated in first trimester of pregnancy. And this is because evidence shows that there is a small increased risk of babies developing cleft palate as a result of having ondansetron. The only exception to this is if it's a life-threatening situation and you feel that the risk to the mother outweighs the risk to the baby. Looking at the breastfeeding section, we've also added detail into there. It is safe to use in breastfeeding, and there are no special precautions that are related to this section. So the evidence shows, because it is safe, then we are saying that you can use it for breastfeeding mothers. We have been working with the Royal College of Emergency Medicines on a project regarding the importance of patients taking their time-critical medicines. A new poster with the mnemonic MIST has been included in the Medicines Overview guideline, along with the wording advising that time-critical medicines are taken to hospital with patients. So the mnemonic stands for movement disorders, so things like Parkinson's and myasthenia and patients' medication. The I is for immunomodulators, including HIV medicines. The S for sugar, for any diabetes medication. The other S for steroids, so things like Addison's and adrenal insufficiency. The E is for epilepsy, so anticonvulsants. And the D is for direct oral anticoagulants and warfarin. If your patients have any of those conditions and the medicines to treat those conditions, then it is really important that those medicines go with them to hospital and that you flag to the clinician when they arrive to hospital that they are taking those medicines. This enables the clinicians to effectively validate what's going on with the patients and ensure that both clinically and in terms of safety, the patients are being treated safely.
These updates have been made as a result of feedback received and to bring them up to date with current practice and joint research. It is vital that our medicines are updated in line with changes to clinical guidance to ensure that paramedics know how to safely administer appropriate medicines.
So we've tried to make the information that we're providing on JR Calc easier for you in that clinical setting to be able to make safe decisions for your patients and enable you to keep your patients safe by giving them appropriate medication. So by clarifying some of the indications, expanding some of the indications and age ranges within these medications, we're hoping that this makes it easier for you to be able to do your job in terms of treating patients out there.
Patients with confirmed miscarriage and excessive bleeding can now be offered tranexamic acid without delay where this is included in a TRUST PGD. In addition, TXA can be given in primary and secondary PPH after uterotonics. Please like and share this Medicines Update video with your colleagues to improve patient care. Thank you.